represent this morning. And today, what I'm going to talk about is something that I'm doing that I think everybody could benefit from, and I'm wanting to share this. So, necessity is the mother of invention. So, by necessity, years ago, I started what was called the Pedo4GP seminar, and by a GP that was doing pedo. So my reason for forming that was because there was a need, the need to train doctors to get GPs set to do pediatric dentistry. Now, like I said, I'm a GP, but I worked in a lot uh, offices where for pediatric dentists or alongside pediatric dentists. And I think just my experience over the years, especially starting in a public health clinic that was seeing kids in New Orleans, I got a lot of experience. But then once I started hiring doctors and I'm the billing provider, part of the problem was if anything went wrong, I'm the guy that's held accountable. So everybody is looking at me, especially insurances and Medicaid or whatever. So you got to make sure that they know what they're doing. Not only that, most young doctors coming out of school have very little pediatric experience, and they have fear of seeing kids, and I can't blame them because when you got kids crying, moms that are concerned, asking all kind of questions, dad could get angry about different things, so you're concerned. The main thing we want to do is to have some way of training doctors because there's a shortage of pediatric dentists. So most of the kids that are being treated are treated by GPs. But there's not really a program after school unless you go through a residency program until we start the training. Now, first, I was just doing seminars, and we did a seminar recently in Fresno, California. It was huge. We had 70 people turn out. I only decided to do this one in January, start getting all the notices out, sending out emails, and just going at it and trying to reach out, contact everybody in the area. We got 70 people turned out, 70 dentists turned out for this thing. So we're going to be doing that again. I think we're going to do that in August. But what I want to talk about right now is the Pedo4GP Fellowship. So this is also something that I've been sitting on for a long time, and I was so busy I never really got a chance to totally organize and do it the way that it should have been done. But now we call it the Pedo4GP University. So what we're doing is it's a 12-month program, and we just started. We really just put it all together. And now that we've done the seminar, the next thing is it's starting in June, and we already have two graduates that will be coming on in June that will be joining. So we're looking to at least put two more people in there because each year we'd like to graduate four and certified. So you'll get a certificate. It's a fellowship. And we certify you. We have pediatric dentists and we have GPs with experience that will work alongside. So it's a protege mentor relationship. And you get to work with and we have a curriculum that's set out. The curriculum is basically this. Through my experience, I found that there are only seven areas that you need to concentrate on in pedo. And I used to do this seminar. So there's 70 topics that I decided, okay, I'm going to do a 7 hour seminar. I probably need about 70 topics. So we got a series of seven. Seven is in the Bible. Seven is a number that represents perfection. So so it just stuck out of my mind. Why not do 70, right? And it works because we're striving for perfection. May not reach it, but we like to be excellent. And what we're going to do is we're setting up something that dentists can go through without going through a full residency program if you want, or you can do some of this and decide whether you want to move on to a full residency. But I think that the 12 months, because really the thing of learning and most learning starts after you graduate. Most of the learning, because initially, when you first graduate and you go to take a job, especially working in a system like ours where you see a lot of volume and a lot of kids, it takes a while before you actually value. most of the time I'm losing money initially to get someone trained. That's why it's so hard when someone trains you over a year or so and then you get up and leave. I know a lot of people try to lock it in, but our thing is to have a continuous flow of people that we're training. So here's the thing: we start we by bringing them in June, and we already have a curriculum laid out. The seven basic areas that we talk about is well, the seven. Let me give you the seven basic things that we go over, and I try to keep it simple. And you know the KISS principle: keep it simple, stupid. So the first part is basically the preventive, with the exam, X-rays, well, let's go this. Number one, exam and X-rays, cleaning, so forth. That's number one. Number two, the let's also preventive prophies, fluoride, and sealants. Simple stuff. And then the third part is just fillings, whether it be composite, amalgam, sedative fillings, so forth. And then you have pulpotomies and pulpectomies. You have crowns, which is either it's SSCs, resin crowns, or the aesthetic crowns. Extractions, that would be number five. Number six would be things like interceptive, space maintainers, ortho appliances, so forth. And number eight, the bonus part is education on. So that's kind of stuck in there as a bonus: education on how to deal with parents and patients, and you got to become teachers. So that's the thing that we teach, because behavioral management is the biggest part that most people find to be a problem. The other seven, as Dr. Don Brown, a pediatric dentist that I worked for, he had a big practice out in Cerritos, but he used to say, Lanier, a well-trained chimpanzee could do 80% of this. It's only the other 20% that really you have to focus on. That 20% is doing things like communication with the parent, compliance, because there's regulatory compliances, and therefore you have, wherever you go, you want to learn compliance. But communication skills with the parent and the patient, that's a big thing. That's what we really have to teach: is how do you communicate so that you're relaxed and the parent is relaxed and the patient is relaxed. And then there are just some common concerns that everyone experiences, but you only get that if you're actually in there practicing and seeing. So the big thing is experience. You got to get in there, and as you're going through it, you address it. You have a system, and you have people around you that have been through it before. And when you're seeing it, then we address it. Establishing a self development plan, uh, and that's the protege mentor, that the self development. But it goes further than that. And as entrepreneur dentist, I have some courses that I would recommend to anyone, because you may say, well, I don't really need to learn about the entrepreneurial part because I'm going to just be clinical associate for the rest of my career. That's true, but you still want to know, how do you invest your money, and where do you, because at some point you have to get off the what do you call it, the wheel, the not a Ferris wheel, whatever it is. But anyway, you're going round and roundabout, and then anything could happen, because uh, shit happens. If it can, it will. So you have to be prepared, and the only way to be prepared is start learning and learn some things about the financial side of it. I like teaching that kind of things if you join us. But then a critical part that we added years ago is peer review. Peer review is so important. If you're within a network, your pre-op, post-ops, and so forth, so that you're being watched, and you appreciate it. Even your own X-rays. If you're even the treating doctor, we want everybody taking post-ops. Occasionally, we would just assign, sometimes randomly, taking post-ops, and then we compare post-op, pre-ops. We let the group look at the X-rays and give feedback. This is anonymous kind of thing. You're not being called out, but then we start getting feedback. Now, if it is your case and is something that needs to be brought to your attention, then we're going to do that privately. But that's the way that we try to keep everything on par and that everyone accepts. Because the other thing, if you're working for an organization, you want to have pretty much everything standardized. And the only way to do that is that we look at it together and we start to discuss it and talk about it. So that is the main thing that comes from peer review. You grow and by opening up and by keeping it anonymous, you can open up on the case because no one really knows that it is your case. And then one of the things that I think is good, I'd like to teach is proactive patient relations, how to know when you should do something proactively rather than waiting and being reactive and then things happen because they will happen. You just got to know how to head it off when you see it coming. And by studying the psychology of cells and human behavior and how to react, you'll have a plan and you already have that. And if you do it enough, it becomes automatic and you don't really have to think about it. And lastly, the biggest thing that we can provide, especially this Pedo for GP, if you join our group, is experience. Experience, experience, experience. You have to get that and you have to go through it. There's a learning curve. Everybody has to go through that. So we bring you in, we have a structured curriculum, and we get you to do some over the shoulder. We get some peer review, we get feedback, we get guidance, and you talk to different experienced clinicians, and we grow the program. So we're just trying to spread the word, but I'm going to have more. So the pedo it's called Pedo4GP.com. We're changing because right now I think we still have something regarding the previous seminar that we just completed, but we're putting the fellowship information on there this week. So, well, it's coming week. So do check it out, Pedo4GP.com, and we're going to have all the information. Share it with your friends. Share it with anyone that you know, young doctors out there, or we even take experienced doctors or older doctors want to switch from adult dentistry to pediatric, get great experience, get a certificate, and I'm telling you, you'll be busy for the rest of your life if you just go through a course like this. And then not only will you be busy, you will be in your comfort zone. We can get you to your comfort zone, whereas you're enjoying it because as I say, it's pretty simple. Most of the pediatrics and a lot of it is actually done by auxiliaries. You can get the auxiliaries do quite a bit of the preventive stuff, and the restorative is fairly easy once you kind of know I'm going to do it like this every time. You get that down. Uh, there's seven basic things, and you get those. As I say, I'm trying to reiterate. Dr. Don Brown used to say Lanier, 80% of this could be done by a well-trained chimpanzee. It's only the other 20%. Because every now and then something will walk in that you've never seen before. You need to have someone that you can call on really quick for help with that. Then there are just things that you need to do and the time and experience will get you to. There's also in that 20%, though, like I said, is the behavioral management. How do you handle um, a patient that is high anxiety? How do you handle the parent? How do you handle someone who's really rude or whatever? Those kinds of situations is stuff that we have experienced and we can help you with. And then you get within your comfort zone. After you've done so much, now you can establish after your 10,000 hours, as Malcolm Gladwell and also Dr. Don Brown used to say that about crowns. I was like, Dr. Brown, how did you get to be so fast putting on these stainless steel crowns? He said, Lanier, once you do your 10,000th one, then you'll be fast. And Malcolm Gladwell came back later and said 10,000 hours to establish expertise. That's pretty much true. You can bet on that. You're not going to just, and that's why a lot of times when people come to me and they say, "Well, doc, I want to make it really quick, just a year, 2 years out of dental school, and I just want to get rich. I want to be rich like you, and I want to just I don't want to really do any work." Well, I think it takes anything that's really worth having is upstream from work. You see, you can't just overnight because I don't have any kind of thing I could tell you that's like an overnight solution. Everything requires that you get some experience under your belt. So you got to start your journey And the main thing is get your core learning down. Learn to really be a great clinician. And two, learn business so that you can learn how to exit. If you want to exit and do manage and run a business, then you have to become a businessman and you have to learn some entrepreneurial kind of things. So, and you learn how to prototype. That's the thing that we do when you're starting. Uh, you're going to make some mistakes once you start your own with anything, even just your clinical. You're going to start with some mistakes, and you're going to learn from there, and you're going to improve. But with your business, you build it with the intent that it's a prototype. The first few you're building because you're actually as you're building, you're tweaking it, and you're trying to get to a point whereas you're innovative, and you're coming along. You say, "Well, wow, it's an iterative process. You're learning and you're tweaking. You're learning some more. Wow, this works better if I were to do it like that. And I like the way this is, but I shouldn't have located here. I would have done better there. Or you do this, and I'm telling you, so everything is a process. If you make it a learning process, then it's a growth thing, and you're just getting better as you go. And that's the thing I really love about it. We're getting better as we go. We're just doing this. We learn, and I can lean on the many, many years of experience that I have. So I use that, but there are a lot of things that are new that are changing all the time. So you can't ever get stuck on, well, I knew all of this and I have all of these years of experience because they're new things. The experience should just teach us, damn, I got to keep up. I need to really boom, 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 and always learning and using whatever, leveraging your knowledge. And then I was going to mention this. Because I'm going to keep it short today, guys, but I also wanted to talk about leverage when it comes to um, financing, a big thing. Well, one, as you grow, you're going to want to accumulate some assets because otherwise, if you take home money, you could say I did very well. I'm almost rich. Rich and wealth are kind of like in the same category, but wealth is measuring assets. Rich is most of the time what's your cash flow, but that could be gone at any time. So you really want to establish assets, and your assets that you really want are what we call performing assets. That means that they're cash flowing, they're throwing off money. And I'll use this example. I have a couple of offices that once I sold kids dental care, then the purchaser leased those offices from me. So they're paying, and on the exit, of course, they wanted me to pay off the loans on the building. So I had to pay those off. So the buildings are free and clear. And now they're throwing off cash flow every month. So every month, and because they're triple net leases mean that the tenant pays and if you're in one of these leases, you know already, you pay not only the lease, but you pay the insurance, the taxes, and any common area maintenance that goes on in the building. So that's a triple net lease. Much better than these residential. A triple net lease, I'm telling you, it works. So now you have a performing asset and you could go back and and because they're well established, you can go back and take a line of credit on that while it's still making money rather than sell it if you need money and it's already paid off and you have a long-term tenant in there. Then you, of course, lenders would love to loan to you, but there are specific lenders, dental lenders outside of just Bank of America or Wells Fargo or these banks. Really hard for an entrepreneur when it comes to growth dealing with banks because banks want to dictate how you're going to do, when you're going to do. I cannot, as an entrepreneur, I cannot allow somebody that has no knowledge of being a dental entrepreneur tell me how to run a practice and so forth. So I try to stay out of the way. So that's one way of leveraging if you have assets. But the other one is called a SB lock or security-backed line of credit. Now, that one is one you should look up as well, a SB lock. And they use a strategy called buy, borrow, die. You buy securities, and if and normally this is once you have money. So I'm speaking, if you don't have it, you can still learn about it, but don't waste too much time because you're not there yet. But anyway, a securities-backed line of credit, if you own securities, stocks, bonds, so forth, in your securities portfolio, since that's pretty much liquid, you can actually take a line of credit against that while this is still a performing asset. It's performing and it's throwing off money as long as it's throwing off more than the interest of what you're borrowing it for, then it makes sense to borrow on that and let that continue to perform. And it's the same thing with the real estate. It's still performing and throwing off the money. You just borrowed against it, but the performance is throwing off more than the interest that you're paying for the loan. I hope you follow me with that because either way, you're leveraging. And what we really want to do if you're an entrepreneur is parlay what you have over here into something greater over here. That's parlaying this thing. And that's part of the fun. That's the game that we play is how do you parlay from this asset that is here into something higher over here by using strategies. And I'm telling you, I love teaching this. A lot of times people aren't ready for it and most people think that it's only uh, my take home that really matters. And that is the one that you want to get away from because that is taxed at the highest level. When you're doing these other things, you're not really paying a lot of taxes because these are strategies that are written for and by rich people. And if they're not writing them, they're having their congressmen write them because they're having people there advocate for them. There's a person now that's very wealthy, that's really writing laws and changing things that we're doing in this country, and wealthy, and everybody around them are wealthy, and the laws that are written are for the wealthy, and the poor suffers. And I feel some pity, really, and sorrow. But the thing you don't want to be is poor and using habits that the poor use. So we teach that as well. We teach a lot of things as far as entrepreneur dentists, but you have to join. What we want to encourage though is spread the word about the Pedo4GP. We need to get two more for this year, starting in June till next June. We're going to have four doctors in the program, and the sooner they apply, then the better. And we will have everything on the website in just a few days. So do spread the word. I look forward to hearing from you guys. If there's anything that, let me see, I have. Let me see a message I want to can't really read it now. So um, anyway, we are going to end it because I don't really feel it well this morning. A little bit of congestion, you might be able to tell. And I just want to appreciate you guys for joining. Thank you so much. Look forward to seeing you next week. If you have any topics that you would like for me to address, send me an email. You can send it uh, Dr. Lanier at entrepreneurdentist.com or Dr. Lanier, entrepreneurdentist at gmail.com. That's the easy one. I don't want to confuse you or myself. I know I have a lot of them, but entrepreneur at gmail.com is easy. Just send me your concerns. We'll take care of it. Thank you so much. Bye.